Sunshine's Corner, being brought to you by Quint and Richie Studer.
Good morning, ladies. He said something in my ear he shouldn't have said.
Oh.
Okay. Welcome into the hottest spot in town. As you can tell already, this is a lot of fun because when we walk on smiling like this, obviously we got some great information to share today. Not only is it Wellness Wednesday, but we call it Wellness Every Day. But we bring it to you on Wednesdays, right? I've got to welcome my girl Joy. And of course, I've got Leslie in with me today.
Yes.
Leslie, this is your first time sitting on the hottest spot in town.
It is. I'm excited.
I'm so glad to have you. But let me put a pause here. Let me say this. Joy, I always like to recap. We had an event this past Saturday, and she is such a leader, organizer. No, I watch, and that made that event so just right. Kudos to you.
Thank you.
And it was all about health. It was all about filling those areas where there's sometimes people don't want to talk about the things that they don't have. Or they may think, oh my God, I can't get this. Or, oh Lord, what am I going to do about this because I can't have it. But you opened the door. And I tell you, and the flood just came right on in because I tell you, that when we did that live, it went by so fast.
It did.
And I just want to say to you, for all of your hard work, and you know, Leslie, when you got something here, and sometimes you can't get it out of here the way you want it, but your actions show where your heart really is. And that's what that event was. That was the first leg of the tour of
First
wellness.
leg of the tour of wellness, correct.
And it was so wonderful. I want to hear you, because look how she bit the lip. She said,
It was amazing. It was amazing. It was, I often tell people, when you do what you love, you never work a day in your life.
it's not work.
And I'll be honest, I was a little slow that morning because I had to get up so early, and we had something the night before, remember? And but when I got to the facility, and I saw the smiling faces of just the volunteers.
Exactly.
I was like, "Who are you? You better get yourself together." You know. And so yes, from the first person that walked in the door at about 10 minutes to 9 to the last person that left at about 3 p.m. Because you know it's only supposed to go to 1.
Exactly.
But we had people that were watching this show that were coming in to get mammograms, and of course, we wanted you to pre-register. However, if you walked through that door and you needed it, we had the equipment there to just get you together. The technology.
I had a person yesterday that walked with me, right? She said, Sunshine, I want to say thank you. I got my niece there.
Yep, that's who. Yes.
She said she was 40 years old, but I got her there, and she got that test. And I mean, but you think about things like that, that makes you smile for all the hard work. And I can say thank you. I'm glad that we're partners.
Yeah.
I'm glad that we can work on things to make the community better. And now we're going to be putting Leslie in on it.
Leslie was in on it. She just didn't know she was in on it, but she was in on it. I mean, we've had a lot of conversations about Saturday leading up. So we have an internal and an external planning team. So I need to say institutional, internal, and external. So on the institutional level, Florida Blue is our partner in this. You saw their stuff at the bottom, you know, and so a lot of this we wouldn't have gotten done without the partnerships. And so I'll tell anybody, no man is an island.
No man.
So you got to find people that you can link up to.
Yes.
Especially if y'all have the same heartbeat.
Exactly.
Yeah.
Exactly. Tell us about you, Leslie. Come on now, because I mean, you were behind the scenes with your part.
Yeah. Well, you know, Joy has a vision, and then we just get on board, right? You're describing her, and I'm thinking about being visionary and how we serve our community.
Yes.
We're all seeing the same health problems. The data is the data. We know that a lot of people in our community are not getting the care that they need.
Exactly.
And we've got great health institutions. We've got all these great resources, but the numbers, you know, sometimes we're not seeing that. So what can we do to bring it to people? And so that's really what Saturday was about, is bringing it to the people and giving them that access. And, you know, hopefully when someone at 40 gets that first screening, then they're on that path forward. So when they're 41, they're 42, they're 51, 52, they're still getting that, and you helped break that barrier down.
The joy I saw in her face yesterday when we were walking, right? I mean, she was like, oh, Sunshine, she got the, oh, thank you, we did it. She said, I was looking for you. I said, baby, I got around, I did my little spin around. I had to go somewhere somewhere else. But anyway, it was great. And I like that because when you see how if we talk about things, I say this every day, be able to talk about whatever it is that you have in here so that we can take care of it out here.
Right.
And because if you don't share the need, just me, myself, and I, it's not going anywhere. Yeah. But if I can share it with Joy, if I can share it with Leslie, for the people that you know that we confront every single day that we're interacting with in the community, look what happened.
I often tell people, you know, from a spiritual standpoint, we talk about gluttony. And it always goes back to food, overeating. But you can be gluttony in information.
Thank you.
Meaning I'm taking all this stuff in, but if I'm never giving it back out,
come on now.
Why am I sitting on it?
Exactly.
Why am I sitting on it?
And it's like this. I is singular.
Yeah.
Us, we can do it all. Let's connect the dots. And I often tell people, because sometimes we feel like we want to have the football to take it across the goal line. But guess what? It doesn't matter who gets it across the goal line. It's the fact that we're winning.
Right.
When we connect the dots, we're all winning because of the fact that we've made a difference. Think about all the people that had the opportunity to get their prostate screening, and it wasn't, you know, like they thought. It was a tap with a needle.
Yeah, and so that office park is open on Saturdays, and we had people that were coming in just to get like blood work labs for their doctors, and they saw what we were doing. It was like, hey, I can do this, and I can get this done, and I can get it. So it was really a holistic approach, and we talk about holistic.
All
like
the time.
Vendors that were in there we had Florida Blue, we had Council on Aging, we had
Northwest Florida
Health Council, which did all of our borderline baseline screenings. I mean, we had United Way was there talking about 211 and benefits.
Exactly.
And it was amazing. And Dr. Justice walked in.
Oh, Dr. Justice stole the show.
He was just like, wait a minute, where'd all this come from?
No, he didn't say, he said, wait a minute.
Wait a minute, you're right. That's what he said, yeah.
I love him. And but what he has when it comes to health, what comes from him, you cannot fake.
No.
He is so from the heart to get people to, when you speak of breast cancer, Dr. Justice, you may have to say, what did you just say? I tell you like this, Sonshine.
I had to tell him, slow down.
Because sometimes I can't. You know, he's a native, he's from Africa, but I cannot understand some of the words, but he is so great at what he does. And every event that you see out there, that when they're dealing with health, Dr. Justice is going to show up.
Yeah, and he's going to critique it.
Yes, he is.
I had Dr. Wiley was my spy. I said, I need you to go through here and tell me what we're missing.
Right. And
it warmed my heart when she came back. She said, Joy, you're not missing. You're missing more people.
Exactly.
But that's it. She said,
and they came in spurts.
Yep, they did. They did.
It was in spurts. They don't never, we didn't have a line around the building, but it was spurts. But it still, I think it exceeded what you had in your mind.
It did.
Where it was going to go with the first step of that. Come on. Yep. But now, let's give her a kudos. We got to talk about some other stuff.
But look, I was mad because I had to stop and get on video. So they was like, Joy, come on. I'm like, no, I'm working.
That's right.
I was in my element, but I did it.
But you handled it, girl.
I did.
I mean, and I got to say Alicia from
Council on Aging.
Council on Aging. That girl has a personality.
She does.
It is such a blossoming thing, right? And she's, no, Sonshine. You know, and I don't have to ask her. I just ask her one question. I sit back. Because she's going to take it to where it needs to go.
She got them seniors out. They were down there in the lab, in the rehab, stretching and learning how not to fall. It was amazing.
Oh, that was great.
But let's go on to something else.
Let's go on to something else. Okay, now, tell me about Florida Blue and what you do. Tell me about what we're talking about today with Florida Blue.
So Florida Blue, obviously we are a health solutions company, so looking for ways to help connect people with the resources that they need to have healthy outcomes. So we know that we are only as healthy as our communities and all of the members in our community, whether they're Florida Blue or not. So that's the conversations we love to have. What can we do with these events where we can connect people with resources? How can we break down those barriers where people are hesitant to get care, to get these preventive screenings? Because we know if you don't get them and you don't get them early, there's very different outcomes, right?
My mind is rolling like a machine gun right now. You know what I'm saying? I'm seeing things.
Well, and we look at that data, right? We're looking at the community as a whole. We're looking at zip code by zip code. What are those social determinants of health that are really affecting those health outcomes? And we see that just things bubble up. One of those is breast cancer, of course. It's October, so everything's going to be turning pink.
Everything pink.
We're going to be talking about it, but I don't think we can talk about it enough.
I don't think so either. I don't think we should limit it to October.
There we go. Well, Escambia and Santa Rosa County, our numbers of breast cancer in this area exceeds a lot of the state. So we are a high risk area.
Are you serious?
Yes, ma'am. I'm gonna pull my cheat sheet.
Oh,
I'm gonna pull my
please
cheat
don't.
sheets so I can stick to my numbers.
Yeah.
I mean, that
It's truthful.
It is true. Yep. So we are in the top 25%. We rank 14th in the state in Escambia County for incidence of breast cancer. Our
Really?
friends just east of us in Washington County, they're number 5.
Really? Mm-hmm. Now, I love data like that because I was not aware that it was that high here in Escambia County. But now I want to go another route. I'm going to ask you another question from a community. Do you have it broken down from black, white? Tell me about that. Which community is affected the most? Is it black, white, Asian, Hispanic? What?
If you want to jump into it, Joy, I can tell you. Obviously, Joy will be the expert here. But the long and short of it is, at least in some of the things that we look at in the day that we look at, the women who are being diagnosed with breast cancer the most are white women. The women who are the higher incident of death are black Hispanic women. So we can deduct what those issues are. That's Joy's specialty.
Lisa. She just said now the most affected are white women.
No, the most diagnosed.
Diagnosed. Oh, okay, my wrong word. Thank you, doctor.
You're welcome.
Okay, the most diagnosed are white women, but the most death are black and Hispanic. Why?
Well, when you talk about a health disparity, that is basically when there's difference of outcomes per racial or sometimes even geographic, right? So what that means is, and I'll tell you why that is, most white women have access to certain things that women of color do not have.
Okay.
So yes, they're going in, they're getting the test, but when you talk about women of color, because it stays underlining so long and they may not get diagnosed early enough.
Exactly.
Yes, so when in the Mississippi Delta they call it low sick. So we wait until low sick. Like I'll give you an example.
They call it what?
Low sick. They wait till people get low sick.
Low sick.
And so
I learned a new phrase today.
Use it, y'all. It's
I didn't know.
and I ain't even from the Mississippi Delta,
I mean,
but
Leslie,
I loved it.
I called her Lisa.
Lisa, yeah. So the thing about it is, we had those mammograms done on Saturday.
Right.
Somebody's gonna get a result back. And it's not gonna be a result. It's gonna be saying, I need you to come in and get further testing.
Right.
They're gonna stop.
Really?
They're not gonna deal with it anymore. They're not gonna come, they're not gonna call back, they're not gonna come back. So that when we talk about early detection, so when you get that and it says, no, I'm not going in, when you get to that first hurdle, right? Let's fast forward 5 years down the line, now you're having symptoms. So that thing could have been underlining.
Hold up. Symptoms are such as?
Symptoms could be, symptoms could be soreness.
Okay.
It could be discharge. It could be, feeling a bigger lump. And actually, sometimes you have to go right under here because this is where your lymph nodes are.
Right.
So, but you wait 5 years. So that's 5 years that has gone by with this disease possibly underlining that you have no treatment for.
Oh my God.
You haven't, and so that's why the disparity is so detrimental for women of color.
Do you think they're afraid?
I don't know if it's afraid, because what I call the hard to reach women are the people who fill out all the paperwork and they don't show up. So they gave us all this information and they don't walk through the door. Right, that's fear, right? I will tell you that a lot of times it's because I don't have time to deal with this. I'm in survival mode. So if I add this,
how am I going to do
how
this?
am
I don't have time to be sick.
Right, I ain't got time to be sick. I don't have time.
That's what women say, right?
That's what we say.
Really? I had on Monday, it was Tara, Miriam, and they were talking about some things that were so I didn't realize, right? Even with the fact that when Emily, with her boutique, what she has, and the things how they dealt with it when they first found out. So I'm thinking now, is that because you don't want to feel what you don't know won't hurt you? Or is it the fact that I'm going to keep this here, so okay, I'm going to die anyway?
It's a little bit of both, but it's learned behavior though, right? It's learned behavior. So you have to have that community, and I have to give Florida Blue their props as well, because I remember probably about 3-4 years ago, we had a client that was newly diagnosed, and it was a he. It was
Say
a
that.
he. He was newly diagnosed.
Now, hold that.
Yes.
We're going to go to break. I want to talk about this he. You know, because men think I'm okay. Because I'll never forget the one star, Richard Roundtree, who had it. And it was like, but he talked about it and lived a long life. But ladies and gentlemen, we're going to talk more about that. It is Wellness Wednesday. Not only do we talk about the wellness of the tatas, we're talking about the wellness
Not
of the
tata.
well,
Of the ha-has.
the ha-has.
Ha-heart.
Tata-ha.
The ha-ha.
We're going to be back with more right here on Wellness Wednesday with Sunshine's Corner.
Yeah. Good day, Pensacola. Welcome to a new segment on health and wellness sponsored by Baptist Healthcare in partnership with Sunshine's Corner. Every first Wednesday of the month during Sunshine's telecast, we're going to be bringing you information about health and wellness and ways to make sure we're improving the quality of your health care here in Pensacola. After all, we want to ensure that you're going to the right place at the right time and for the right reason, and that you don't feel alone. Can't wait to see you.
At FPL, we plan for storm season all year long. We're strengthening poles to better withstand severe weather. We're clearing lines to improve resiliency, and we're constantly training teams to act at a moment's notice. Because we're always working, always preparing. So when storms do hit, you can count on us. FPL, working for you every single day.
For the past 5 years, Blab TV has worked with the McCullough Institute and Plastic Surgery Clinic here in Gulf Shores to get our message out to the public. Blab TV works. I am Dr. Galen McCullough, and I am Blab TV.
I'm Emily Echeverria, Marketing Communications Director for Council on Aging of West Florida and the host of Coming of Age. Watch our show to find out what we're doing for our seniors and their families, and hear from area experts and local business owners about their programs and services. Want to help? Find out how you can work with us to bring a better future to our seniors. Watch Coming of Age, 3:30 p.m. Wednesdays, only on Blab TV.
I'm Kathy Holsworth, Artistic Director at Pensacola Little Theater. Join me on the first Monday of every month at 7 p.m. for the Center Stage, where me and my artistic friends talk about all things on the stage and at the Clark Family Cultural Center. Join us, won't you?
You know he gonna count.
And welcome. No, when I laugh, that's only I'm happy. George, did you see that? She said, "Well, are we back?" But we are back with the hottest spot in town. This is why I love this show like it is, you see, because I don't interview people. We have conversations. We talk about things that we can get more out of. And because if I say, "Joy, what time is it? Do you know where it goes?" I mean, that's going to be just a strict conversation. But this way, laugh and get the information out. Dr. David Joseph told me yesterday, he said, laughter is so wonderful. We should learn to say, "I love you," and laugh more often.
It is.
And laughter is good for the soul. Now, you were talking about a gentleman that had been diagnosed.
And lived alone, didn't know, like, he was with our pop health team. Florida Blue member, because that's what they call them. They don't call them clients. They call them members. What that means is you're a part of me, because the members of the body, right? And so he they did a malnutrition assessment, and he didn't know what to eat because of what the chemo and radiation was doing. I called the Florida Blue Retail Center and spoke with one of the care navigators, and baby, they had Boost at the door. They had all time, but these were benefits that he didn't know he.
You said boots.
Boost, like the
I
drink.
thought you said boots on the ground.
That was before the boost. Look, that was before that. But yeah, so that center that sits there at Airport and Ninth, it's a beacon of light for our community, and it's center in the community. Think about where it sits.
Exactly.
And a lot of people don't know that they can go in there and partake in a lot of things. They do yoga and Tai Chi.
Yeah,
and all of that. Yeah.
And I didn't know that.
See that? She learning.
There you
Watch
go.
how her eyes light up.
I know.
I did not know that. Talk more, because you said there was something else you wanted to talk about.
Yeah, 2 points I want to talk about there. So one, we'll talk about our Florida Blue Center. It is. Sometimes it's a little bit of a hidden gem here in Pensacola. It is on the corner of 9th and Airport.
Exactly.
And people drive by, they think, oh, it's just a sales center, and it is so much more than that. So we have a team there. Of course, we'll sell you products, and we'll talk to you about products and solutions. It's open enrollment time. We'll do that all day long. But we also have we have a community specialist, which is a social worker who is there to help people, whether they're Florida Blue members or they're not, connect with resources. So if someone says, hey, maybe I need transportation to the doctor, or I need help with my medication, or I'm making some tough choices about my health, they can walk with them through that. We have some free personal health assessments. Sometimes that's a good way to get someone through the door who maybe is hesitant to go to the doctor. They're hesitant to get that screening, but they can come in, they can meet with a nurse. We'll look at their blood pressure, we'll look at their cholesterol, and start having that conversation and start helping them on that path. I had mine done on Saturday. I was in the center and got my flu shot, had my PHA done. Talked about my cholesterol, talked about my blood pressure.
Talk about the flu shot more.
So we had a flu shot clinic on Saturday. So those are just resources we have at the center. And then we've got free classes all the time. Again, you don't have to be a Florida Blue member. There's yoga classes, there's Tai Chi classes, there might be scrapbooking class.
May I ask a question off the board?
Of course.
What is Tai Chi?
It is, I am not a Tai Chi expert, but it is a type of movement and breathing that helps with relaxation, physical movement. It's an ancient, I believe, Chinese practice. Yeah. And breathe and move. So wonderful health benefits for physical and mental health with that. And so those classes are busy.
Do you think sometime maybe when a person does not have the insurance, I can think about our guy, when you don't know what to do, do you think that's a hindrance for people coming in to find out what they can get? Because nobody's going to know your business. That's your business between you and...
But here's the thing. What's wrong with people knowing our business? Because guess what? When I hang up the phone, I'm gonna call somebody else anyway. So
when somebody walk past it, Sue Sally Jane gonna talk about what they think.
If the business is going to help me, please know it.
Exactly.
Please know it.
But you know how some people are.
If you're not going, if you're not going to talk about that and take some ownership and have those conversations, then how are you going to maintain that health? How are you going to maintain that wellness? Because eventually you're going to need help. You're going to need to have that conversation sooner rather than later.
And this is the conversation we're having today, ladies and gentlemen, because you see, I bring up these points because if there are things there, because there's so many people, and I know, that are afraid to say, well, I don't have that, but I only have this. But if you're seeing all of these things that can get you lined up, if they got to lure you in with anything to talk about whatever it takes to become a member so that you can take care of the only temple you're going to have, then do that. And I'm finding out that, with the classes you all give, come on. Yeah. What's the process to get the shot? You wake anybody, if they pass out, you wake them up?
Wait a minute, don't do that. don't do that.
Look, I'm gonna tell you when I took my first COVID shot, the man said, I put on a show. I said,
you lied, Sonshine.
I said, oh God, help me, somebody, I'm so scared. Yeah. He said, does it hurt? I said, he said, okay, but I'm done.
Yeah, and it's even Saturday, we had a young man come through there kind of early. And he was just circling the table with the health screening. I said, you scared? He was like, I don't know, I'm scared of needles. I said, well, do you want me to hold your hand?
There you go.
He was like, you married? I said, no. My husband is not gonna get mad because I held your hand.
Thank you.
While you getting it, but let's talk. And so when he finished, he came to find me. He said, now what this mean? What do these numbers mean?
But do you see what you provided with him?
What do these numbers mean? And so, when we talk about like flu shots, it's not for everybody.
Right.
But if it's for you, then get you one.
Okay.
You have the pneumonia shot. You have shingles shot. Yeah, you have all of these. This is still preventative health.
Thank you.
But we can go down a rabbit hole with vaccine hesitancy, but it's not for everybody.
Exactly.
Right.
Exactly. Now, what's the process if a person want to come talk about getting those vaccines that I think that are needed with some things? You know what I mean? What would they do?
So for us at the Florida Blue Center, come on in. We have a nurse there who'll sit down, talk you through that. The other thing too is, I encourage people to talk about their benefits. when we're talking about mammograms, things like that, sometimes the hesitancy is I'm afraid to go because I'm afraid that there's going to be a cost that maybe I can't cover, right? And so really it's encouraging people to look at what their benefits are. You want to take full advantage of them because if you have health insurance, you're paying for them.
Exactly,
so
use it.
So use them. Most of the time, a mammogram is a fully covered benefit that you can get. We're expanding what we cover starting in January too for different diagnostic screenings, things like that. More of this breast cancer diagnosis and treatment. And that's going to be at no cost, little no cost. So have a conversation, understand what your benefits are, understand, I know at Baptist they'll talk with you about any expense that you may have. Walk through that, understand what that is, so that you're overcoming that maybe hesitancy based on cost or cost that you think you might have. So sit down with someone, talk about your benefits, whether it's mammograms, vaccines, you name it. They can talk through what that is.
Yeah. And I can say this about Baptist, I've known this for years with Casey. I have worked with her for years on the fact that with those mammograms.
Remember bras across the bridge?
Oh, God. We used to connect those bras.
We connect those bras across that bridge.
Cross that bridge.
So I want to read a text message that I got on Monday. It says, "Hi Joy, how are you? Hope you are well. I have a question. So they called me back from the mammogram place this morning. They said they need me to come back and they got me for their next opening appointment. They said that they need to take more pictures and do an ultrasound and then they will tell me what they find. Will I be charged for all those extra testings like ultrasound?" And I responded, "No, you will not."
Oh, look at the children.
So I checked on her last night. I said, "How are you? When is your appointment?" She says, "I'm okay. I'm tired. I'm trying not to worry about it until my appointment. It is October 14th at 9:15. My friend told me," there go them friends, "most likely it's because your breast tissue is so dense that they need an ultrasound for a better picture." But she just wanted to know.
Yeah.
And this is a Cambodian woman.
Okay.
Yeah, she's Cambodian, but she wants to make sure.
Exactly.
And so that's kind of the whole kit and caboodle. I will tell you also, we talked about the family doctor. They have a family physician at airport and night at the Florida Blue Center.
Really?
Yes, they do.
We do.
Unbelievable. Now, I used to be over there at Florida Blue a lot because y'all did with the show I had when I was on radio. And I did remote sale once a month.
Yeah.
And we would bring people in. And to talk about those screenings and to reach, this is the thought. I'm glad now I can roll this in. Okay, now I see now we're talking about people who possibly have, and I think you're trying to reach some of those people who do not have. They are low income in the community. They are, I'm okay. The avenues that we need to reach, it's a group of people out there that I know that the message is not getting to them because of, I'm out there all the time and I know that it is, but how can we come up with something to create that confidence to let them know, okay, auntie, cousin, grandma, grandpa, whoever it may be, that here is a place that's going to help you with the things that you need to know, grandma, so you can continue to make those biscuits for me. Do you, with the butter, all that kind of good stuff, because I know that there's a link, only because I see it. We've got, with the things like, and that you're doing with the collaboration of connecting to go into the community, I got so many things I think that we could consider to reach those that we're not reaching. Do you understand what I'm saying?
And let me be clear, we want 850 to be healthy. Healthier 850.
Exactly.
That is what we want. And so we understand that the vehicle looks different for different subsets of people.
Exactly.
Because even when Brian was on Saturday on Live, he talked about small business owners.
Yes, he did.
And so they making sure that the business doesn't fall, but they don't take the time to take care of themselves. So that's another sublet of
Exactly.
So, but we want to make sure that every entry point that you can walk in. Right now, let me say this: our partnership does not exist to get you to come to Baptist or go to Florida Blue.
Exactly.
We want you to get somewhere where you trust. Hopefully it's where we are.
Exactly.
But if not, that's fine. But just go in somewhere.
No, certainly. And the knowledge is is power.
And our guy, Florida Blue helped him too.
Oh, really? But you see how the dots connect.
Yep.
And what we're talking about, ladies and gentlemen, we talk about the wellness. And I am so pleased because what I saw on Saturday from all different communities was there. I saw that. I saw red, yellow, black, white, and brown. Okay, but everybody was walking through there to seek with information that's going to be beneficial to them. I could go on and on and on, but I want you to be able to get what you need, and this is why this show is designed to reach and talk to the community, because there are things that we can tell you perhaps you didn't know, but now that you do know, utilize it, because you see there are so many entities that are absolutely free to get you started on your journey of living a more healthy life. We're going to talk more about that right here on Sonshine's Corner.
You finally found the perfect car in Racing Blue. You even got them to throw in the LED fog lights for free. Auto Owners insures your car because some people never learn to parallel park. That's simple human sense.
Ask the Messick Insurance Agency in Pensacola if Auto Owners make sense for you.
Keep going, more. No, stop!
Are you looking for local and regional sports highlights and insights? Join me, Clifford Early, along with Randy Williams on the Saturday Morning Sports Blitz. Every Saturday morning at 9 Central for a wrap-up of high school games and upcoming college matchups. Plus, interviews this fall with high school coaches and college insiders. Join us right here every Saturday at 9 a.m. on Blab TV for the Saturday Morning Sports Blitz. We'll see you then.
At Pensacola Habitat for Humanity, we believe every child should have a safe place to grow. That's why we work with you and the community to build not just a house, but a home.
She worked very hard to get this house. I really appreciate that because, if it wasn't for her, I wouldn't be here right now.
When you help build a home, you build a future. Pensacola Habitat for Humanity.
The Emerald Coast Utilities Authority's state-of-the-art materials recycling facility processes recyclables for communities throughout the region, lowering need for more landfills. This highly efficient recycling service accepts glass, paper, cardboard, plastics, aluminum, and more. But we need your help. Please make sure your recyclables are clean of garbage, food, and liquids. Also, please remember that plastic shopping bags, foam products, or yard waste are not recyclable. To learn more, go to livegreenecua.com.
And welcome back to the hottest spot in town. This is Sonshine's Corner. Listen, when we talk on right here every day, we find ways that we can educate the community. Things that I think that are so important, and it's proven out because I see that even with the turnout that we had on Saturday, I was so happy to be there. I was so elated to be there. And Casey, when she jumped, I'm gonna have to hold her because she jumped up around my neck.
Oh,
I mean,
wow.
I said, oh, here she comes. I said, let me get my balance. But it's just fun though. And have you seen that little thing? I got it on everything. And Dr. Justice said, hurry up, get me off this.
Yes, he wasn't with that movement.
He wasn't with it at all. But we're talking about, flu shots because today is October 1st.
Yeah.
And
I can't make this up, y'all. This show is live for real.
Yes, it is. I mean, that's the good part about it. Oh, now if you've got questions, 850-432-7768. Do call. I don't want you. I didn't give the number out at first. I was getting so much information that I left them out. But please, you got time to call 850-432-7768 to find out answers for what you need from these professionals here that do it every day. Now we're talking about the flu shot and what with Florida Blue.
Yeah, our Florida Blue Center, we have a few more flu shot clinics coming up, so you can stop by. In October, we've got 2, and so on Saturdays, you can come by, get a flu shot, and get a Publix gift card too. So great way to arm yourself going into cold and flu season.
Arm yourself. I like that.
And hopefully we don't want the emergency rooms full of people with flu, right?
Exactly.
We want to be focused on the things that we need to be focused on and preventing that illness. So it's a good way to do it.
How much does it cost?
It's free.
That's what I want to get out.
You can't
People
beat that.
hear that.
Come in, do a yoga class, get a flu shot. We'd love to see you.
Do you up?
Why the FPL thing?
She said it again. Here she go. Wait, it's gonna come off there in a minute. Okay. Okay. She's Joy. I love her to death. You see, this what I mean. When people show you
who they are,
and if you real all the time, that's what I love about her. You go to get Joy and Joy. And see, that's what people can't handle with me because I'm so straight up.
That ain't that one I love her.
Oh, and she's like,
blue though.
Yeah. He gonna have your logo.
She's gonna send us with a sponsorship packet when we get done.
Yeah, I really want to talk to you.
Yeah.
I mean, but no, but when you talk about these, why I want to go back and say free, because sometimes people say, oh, well, how much is that going to cost? She didn't say how much it's going to cost. Okay, that's free. That's that one you don't have to pull out the wallet, but you get something to put into your wallet.
Right.
You know what
good.
I'm saying?
That's
you
good.
know, with
that's
the gift card, you can go right there and get yourself something from Publix and go home and watch the football game.
Exactly.
And chill. And you got how many more Saturdays?
We've got 2 Saturdays.
2 Saturdays.
Yep. Visit FloridaBlue.com. There's a calendar that has all of those events. So all of our education classes, all of the fitness classes that we have, the flu shot clinics, all of that's there. That calendar changes every month. So it's just a great community resource. And again, open to anybody, and everything's free.
And I send it to you because you know how you post it on Facebook.
Yeah, please do so I can share it, because I do it on all of mine.
We all know we can be more active. We all know we can be, doing more for ourselves, and that's a good way to do it.
And I want to talk about that too, because I'm one for movement. Mm-hmm. I try to get people to realize how important it is to not just become a couch potato, to move around. If you just do 30 minutes of walking a day, you will be amazed at what that's going to do for you.
And I'll tell you this: people think you have to have a gym membership. If you got YouTube University,
please,
you can put on a video and it'll let you walk a mile in your living room without moving out of one space.
You can join with me. I walk every week. I don't push you too hard. I only did 3 miles last night, but you can join me.
Don't join her, y'all.
And then I got a dance class on Thursday.
Start somewhere. I have to tell people, physical activity. I have like tile floors through my home.
Slide.
If I mop those floors.
Oh, come on now.
That is physical activity.
Washing your car.
If you
raking
garden,
your yard.
yes,
gardening.
All of that is activities that get you to moving. Go out and wash those windows. If you see where those cobwebs around the house where the insurance didn't get it off, clear them off. Don't just sit. I try to get them to be active. Mobility.
Yes.
When you're moving with this is going to operate more. And as you mature, I never say as you. It's as you mature.
Yeah.
You need to use that more.
Yeah.
And you will be amazed how far this will take you if you take care of it. If you don't put oil on a car, what it's going to do? Clunk, 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 it's going to blow up the engine. It's going to mess it up, right?
Same thing with your temple.
Same thing with your temple. Use it. You can drive that car. Something I'll never forget my brother said, as long as you keep that car, keep that oil change, keep that car checked up on, you can drive that car forever. Same thing with this. And I do encourage people, and I have to say this. Sometimes, if you put the wrong oil in a car, it will knock. Cluck, 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 cluck. My BMW has to have the 93.
Synthetic at that.
Okay, and if I accidentally put that regular, that 87, it's gonna go.
Y'all, this is a true story.
You put the wrong gas.
I went to get gas.
Put diesel in there.
No. I went to get gas last week and I was frustrated at the pump at Sam's, right? I'm cheap, so I had to go because I can get some.
Oh, me and you both.
And it's right down the street from the Florida Blue Center plug. And so when I realized what I had done, I hit the 93. I told my husband, I said, babe, my car probably gonna quit. Because it ain't used to nothing like that. He told me, it might run better. It won't get no more. But that's true. That is true, right? When we're younger.
That's right.
My grandmother's 93 years old.
Come on now.
My grandma will tell you she don't have any of them diseases.
Thank
she ain't got high cholesterol. She don't have any of that. My mama trying to figure out how her cholesterol is high. But grandmama's is good, and they eat the same thing. But when she was younger, she did the things she needed to do, whether by force or by choice, to take care of her temple.
Exactly.
So now my mom be like, well, I'm gonna have to take her fat back. Let me know how that works. She's 93 years old. Let me know. But she don't miss those. She don't miss her flu shot. She don't miss her pneumonia shot. She don't miss stuff like that. But it's amazing, like how many, like when I think about what this organization does.
I'm finding out too that, I mean, free?
Yeah.
And you've got entities where you can go in a time span and get all this done. People, what's up with that?
Mm-hmm.
Come on. God said he'll give you everything, but you got to go get it.
That's right.
I mean, here it is for you. And I say that when you take care, and with all of the stuff, I think that all of these entities, what we use as a tool that I have learned a lot by with this show, that I was not aware of a lot of things that was going on that was free, that was there for the community. But the fact of it now, I want them to be enlightened in everything it is to take care so that you can live longer. I see now, and I'll say this, and I'm being real, you see younger people more out of shape than you see with the mature people. Because they're on that quick fix thing, that quick fast food. Anything overdone is not good. I don't mind you going out there every now and then, get yourself a hamburger, but don't make that a habit every day. I got to have a Whopper.
Or make it at home.
And you can take a turkey burger, make a turkey burger you think you eating. It's all about how you prepare. Spaghetti, use turkey. Don't get the all fat, get the one with the low fat. Check out those carbs on that. Carbs with what they lay them on you. Check the carb. Learn to read labels.
Yes.
Learn to read labels. If you got something like hypogalactuca,
if it's got close on the end,
I'm not
COSE, you don't want it. But let me say this: you said something about mature. We're about to embark upon open enrollment, and that is locally and statewide, and nationally with Medicare and Medicaid. This is the ample time for people to call and make appointments at the Florida
so they can find out.
So they can find out, because guess what? Sometimes people just, I'm just gonna get this. But that doesn't mean this works for you.
Exactly.
So there are people that are educated, knowledgeable enough to say, this is what you need, to fit your situation.
Exactly.
Because I remember when the marketplace first rolled out, people were so excited because they had those small premiums. I'm paying $40 a month. But when you got to the doctor's office, they told you had to make a $10,000 deductible.
Come on now.
So pay a little more up front so that you can, but this is what the team at Florida Blue Center is able to do.
To walk you through it.
And y'all do dental plans too?
We do.
They do now?
We have dental plans. We have great accident plans too. But to Joy's point, it's having that conversation. What makes the most sense for you, your family, what your needs are, what your health conditions are.
Exactly.
And so it's overwhelming. I mean, I work in this industry. I've been in healthcare a long time, and when I sit down to look at mine, I kind of go a little bit, because it's scary. And so having a good trusted partner that can walk you through that. There's a lot of noise. You turn on the news and lots of changes.
God, that's all you see.
Lots of noise. So I feel like it's always important, but this year it's particularly important to have someone that can explain these things to you. And can walk you through what your options are and why they may be changing. And so trusted partners for that are so important. Florida Blue Center's a great resource for that. And maybe we're not the best option for you, but we want to connect you with the resource
somebody
that is.
who is.
Right.
Now, that's what I call a good business plan right there. That's good partnership when you can say, okay, if I can't help you, let me send you somebody who can.
That's right.
And that's the way it should be. And we're talking about things that are so prevalent in our community. And I didn't say just one, I'm talking about all communities that we need to take care of. I believe with everything that flows through me, if we would break this thing about the lack of knowledge, and when you get the knowledge, apply it, you will see such a huge difference, a better difference. Don't get it and don't use it.
And we come together on some of the most different things. How about we come together for wellness and health? I think about Jacksonville. Jacksonville is a blue zone. Like every restaurant, everybody in the city is participating in blue zone. So what that means is, if Pensacola were a blue zone and you go across the street to Five Sisters, you're gonna see a little emblem beside the meals that are healthy. You may say a little blue zone.
Good.
Now it takes a big lift because the community has to be all in. Because we tried to do it many years ago, right before I got here with Megan. But it's those things. Like, it's when I walk into a fast food restaurant, can I get a salad instead of the fries? Can I make small, because
Changes.
that's what it is, small changes.
And maybe you can answer because you work in that area. And one thing that I see that when I find out, and I always say this every day, I want everybody to please be mindful that this is only temporary where we are. This is going to be, you'll hear some noises, you may see some visual things walking through. But no, we go through the growing pains.
Yeah.
And because I want you to understand that this is only temporary. Give us a few months and we're going to be out of this. It's going to be ta-la. But now, back to what I was saying. When I see, and with my studies and what I try to do, because when I try to talk to the people that's with me, when you see a person when they're not taking as much care, it's the midsection where it grows the first, the stomach. And if you ever touch it, it's hard. That's because what you put in it. I'm just being real. And I think that I had to learn how to prepare my food differently. I am 6 feet tall. I did not want to be 6 feet wide. You understand what I'm saying? So therefore I had to learn to prepare foods differently than what my mother did. Okay? Mother had, and my mother, rest her soul, she said, baby, no, you need to eat, honey. What's wrong with you? You need to eat. But what I'm saying is what she was saying for me to eat, but the food that was not healthy. And that's what they grew up on. But back then, see, we were out in the sunshine running all the time, and we don't have that now. And I see that what I'm saying, I want people to realize, if you pull it up, if you look it up on the internet, find out anyway, it's always here where it comes first. And if it's hard, you need to really go to your doctor and let him get you with a nutritionist to show you how to get rid of that. Eating what you want, but portion control, not so much fried, and cut back on with the cholesterol, cut back on some of these things that's gonna help. All that's in wellness of the health, because that lets me know if you got that midsection that's still sticking there, you eat everything you want to. Read about it. 99.9. Let me go to the break first, then we'll talk about that. Okay. We got to go to break. We'll come back with more answers about. George said, "Wait a minute." We're going to come back and talk about that right here on Sunshine's Corner.
My name's Kelly McLeod. I'm the owner of Bella Magazine. Bella is a source of uplifting and inspiring content for the women of Pensacola.
I think the magazine is just so thoughtfully done. There's a lot of attention to detail. The stories are really good.
You've got seriousness, you've got fun, education, fashion. It just encompasses everything.
Women are multidimensional, and so is Bella.
From the efficiency of American natural gas and the dependability of nuclear power, to the strength of Florida's sunshine and the flexibility of advanced battery storage systems, we leverage a diverse mix of energy sources to power our growing state, ensuring reliable, low-cost power for your home or business whenever you need it. FPL, working for you every single day.
Do you want to create but don't know where to start? Our new fabric line will inspire you. If you can dream it, we can help you make it. From using kits that include everything you would need, to taking classes to create something more personalized, Daryl's is the place for you. No matter if you're just beginning or experienced, Daryl's has you covered. Find us at 6705 North Davis Highway, open 10 a.m. to 5 p.m. Monday through Friday, and 10 a.m. to 3 p.m. on Saturdays.
Well, I think it's all about local, and I'm a big believer in local. So I think anytime you can carry a message out locally, it's important. And I think it's anytime the person that delivers the service can also deliver the message, which is unusual. You have the people that actually deliver the project doing the talking, and I think that's a huge difference, and really makes a huge value difference for the consumer. So I'm really just so grateful that we have this local opportunity with Blab TV. My name is Quint Studer, and I am Blab TV.
And welcome back to the hottest spot in town. It is Wellness Wednesday on Sunshine's Corner. And we were talking about just healthy things, the things that we did not know that was right there, accessible, just that close that you can take advantage of. And it's just that free that you can take advantage of. And you can't say, well, I can't afford that. Can you not afford free? Okay, but you were about to say when we were talking about that you cannot exercise away a bad diet, which you cannot. Ira Wentz, rest his soul.
Man.
That was my boo. You hear me? I mean, he's, Sonshine, nope, Sonshine, you gotta eat this, you gotta eat this. As he was exercising, training me, he was still teaching me the things that I needed to eat. You can't have that. But what I'm saying is we need to talk more about that so we can have that conversation so that people can see, personal pronoun. Personal pronoun, do not believe in that shot. I believe it for people who need it, who has illnesses that need it. But I see the vainness that's going into that shot now. It's everybody's quick. You look around, everybody's skinny. I don't believe in that. Don't take a quick way out. If you learn to do the thing step, and I am a witness from this from heaven. If you learn to do the right thing, it will come off you. But I believe if you take advantage of something like that, it's got to be repercussions down the road somewhere. Because if you're just doing it for vain reasons, and everybody, oh no, I'm on the shot. Oh, I got that shot. Get out there and exercise and learn to eat.
Well, even with the shot, it's not. You still got to do the work.
But no, some people are just doing what I see is like this. Bah. You see them 1 week, next week,
they invisible. So let me say this. I want to give my partner some time.
Hey, because we're in the last break. We'll be talking all day.
Explain the importance of open enrollment.
So open enrollment is the time that you have to look at your health benefits. It's the time you can make those changes. It's the time that you can select what's best for you. So it's really the best time to get educated on what your resources, your opportunities are, whether you are an individual and you are looking in the marketplace or you are enrolling in Medicare. This is the time to do it. And then also if you have coverage through your employer, it's the time to do it. So that is the time to sit down, go, what are those benefits? What do I need? How can I prioritize my health?
Right.
And you can even look retroactively too. We've talked a little bit about preventive screenings.
Yep.
I know it's easy to let a year go by. It's easy to let 2 or 3 years go by. But to me, it's also a time to do a quick evaluation of, did I use all my benefits? Did I get that mammogram that I was supposed to, that I need to get, that is a covered benefit? Things like that. Did I see my doctor this year? It's October. I don't know how it got to be October, but it is.
It is.
The year is flying by. I've got a long list of things that I put on my to-do list in January that maybe I've not checked off, and it's the time to do that. So again, there's lots of changes coming, and we want to be able to have those conversations and make sure you're in the best position you can be in come January 1, 2026, so you can prioritize your health and wellness.
Yeah.
So that is the importance of open enrollment. Something that it goes by quick. It happens over the holidays, so people.
And then they're not thinking about it on the holidays.
Exactly.
That's why you got to get in before the holidays.
There we go. Yep. So having those discussions, making those decisions for yourself, and positioning yourself in the best possible way, so you can prioritize your health, wellness, get those screenings, do all you can to protect that temple, and that's your avenue, your best avenue for doing it.
I love the fact she caught on that I call it my temple.
It is, and I love it. And it's the only one that you have. You can't go out,
that's right.
And buy a quick shot. Go buy a new one. You can't go on Zillow and
let me price
get a new one.
Over here, see
right?
what this is going like. Can't do it.
This is the one. This is the one you've got. So it takes a lot of forethought, and open enrollment's part of that. Talking about what you were talking about with how you inform yourself, and you learn things or relearn things, and how you're going to protect your body, but that's part of it.
Yeah. And you know what else I think also is a great factor, and I see that coming from the both of you? People, the way you treat a person, it's open enrollment, but the way you treat that person that's coming in will have that person tell, well, girl, you need to go over there, they were so nice.
We've been on this road since June.
Exactly.
Right, together.
Yeah.
With the men's health thing that happened at St. John Divine.
Exactly.
So we didn't wait until October 15th.
Exactly.
This is a conversation we have every day.
We've been getting people prepared, because to Leslie's point, a lot is about to happen. And we just need 2 things I'll tell you from our MSA Metropolitan Services area, which is Escambia and Santa Rosa County. We have 2 big pushes: getting people insured so that they can have access, and getting a family doctor.
There you go.
So those are our two, pushes for 26.
Okay.
Yeah.
I got you. Well, I can't say this enough. I appreciate you guys, and because I do believe that knowledge is power, and especially for those who are in the community, because there's a lot of people that won't even call, but when I see them or I heard this, like Saturday, I'm walking out, people saying, oh, I was watching this. I said, let me get up. I mean, but the fact of it is, the information is there, and they're passing it on so that it can be used to the betterment of the community. I'm not going to come at you with the contract today.
We'll package deal.
Okay, both of you.
Yeah,
but the fact of it, and I appreciate your partnership with me, because we are reaching people, and we know that we're being successful at it. And I appreciate that. Ladies and gentlemen, don't forget, this is October, open enrollment coming. Look and see, go by Florida Blue, call somebody, talk to somebody about what you have so that you can be ahead of the game. Don't wait till Thanksgiving and say, oh, I got this, oh God, I forgot to call. No, because there are changes coming. There are things that people need to know so that they can continue and maintain what they have and get more. And most of all, don't forget about the free flu shot. That's a mouthful.
October 9th, October 25th at the Florida Blue Center.
At the Florida Blue Center. This is free, ladies and gentlemen.
And you get a gift card.
And you're going to get a gift card to go to the store. You get a shot and a card. Come on now. Then you can go home and watch the game.
Maybe we should do shots for shots.
But ladies and gentlemen, it's been a fantastic day. We do this every month, Wellness Wednesday. And I tell you, we're going to speak our thing into existence, okay?
I'd have been with you 3 times in a week.
I know it. So it's going to happen. And yeah, Wellness Wednesday every Wednesday. I've got to go, but I want to leave you as I do every single day. Never, ever, ever lose your focus. Always remember this one thing, and I believe that from the heart. If you keep God first in everything that you do, I guarantee you're going to be a total success. So until tomorrow, we're going to be talking about children in crisis right here in Pensacola. So until then, my friends, know that I love you with a perfect kind of love. Go out and tell somebody today that you love them and mean it. Reach out to extend that helping hand. You never know what a smile will do with a person. Until then, my friend, till tomorrow, Joy, Leslie, thank you. I love you with a perfect kind of love. It's going to be a great, great thing that's coming together. We're going to do great things together to help this community. Until tomorrow, bye for now.
Sunshine's Corner, being brought to you by Quint and Richie Studer.